Well, while some of us use prescription drugs for pain, that same prescription can turn into a deadly addiction for others. Blue Cross is committed to improving the health and lives of people in Louisiana by promoting safe, effective use of prescription drug use in an effort to lower Louisianians' risk of abuse, overdose, and even death. Joining us now with more is Blue Cross and Blue Shield of Louisiana clinical pharmacist Bryce Mohandro. Welcome.
Welcome. Good morning.
Good morning. How are you doing today?
Well, how are you?
Well, so far, thank you. Oh. So starting out, we've heard a lot about the opioid epidemic. So set the record straight for us. What exactly is an opioid?
So an opioid is a drug that works on different receptors in the brain. So kind of think of it like a lock and key. And when the drug acts on those receptors, it results in pain relief.
I see. Okay. So what is the status of opioid abuse here in Louisiana?
So in Louisiana, so we've heard a lot in the news, and even the CDC has recognized that there is an opioid epidemic. So we're in the middle of experiencing that right now. So matter of fact, the #1 accidental cause for death used to be car accidents, and now it's drug overdoses.
Is that nationally or here in Louisiana? Oh, wow.
So nationally. Okay. And then within the state, though, we are one of a handful of states that actually has more opioid prescriptions per capita per state resident, meaning that we have more prescriptions written in our state than we do people living here.
That's
which is pretty
unbelievable.
Significant. Yes.
Right. So I mean, why are we prescribing all these opioids? I mean, I know that pain relief for some medical issues is necessary, but with all the knowledge people have about the addiction rates and so forth, I mean, is there a solution?
I think there's a solution, and there's lots of different factors that have got us to where we are today, many of them. But I think what we're focusing on now is education,
right.
Education to both patients, to physicians, appropriate prescribing, more responsible prescribing, and now that everybody's more aware of it, I feel like we're making a lot of progress in that area.
I don't know, me personally, I like to feel the pain. It lets you know you're alive a little bit, you know what I mean? So Blue Cross revised opioid coverage policies. How's that impacted the community?
So our coverage policy has impacted our community in several different ways. So in addition to actually revising our opioid coverage policies, we also did education with our providers, our prescribers, and then also—
Good, so we're actively involved in that process.
Yes,
good to
and
know.
then also the community and just about drug safety in general with the public, our Louisianians. However, the drug coverage policy went into effect January 1st, 2018, and since that time, we have decreased the number of prescriptions written for our members by 13% per 1,000 members, and then also the number of opioids. So we want to look at our goal when we came up with this coverage policy was #1, we wanted to decrease the amount of opioids available to the community.
Sure.
So there's evidence data out there showing that people that become addicted to opioids are getting it from a friend's medicine cabinet or leftover from a car accident or from a family member. So we're trying to decrease that leftover usage and also trying to prevent our members, the Louisianians, from becoming chronic users after some kind of acute event that they were prescribed opioids for. So that one of the other things that we tracked was how many number of opioids are out there, and that number decreased through the first year by about 18% per member per month, which was very significant and honestly a much bigger decrease than I had anticipated.
Okay, wonderful.
By implementing this new policy.
Sure. So I mean, as you mentioned, it's important to not leave unused prescription drugs around the house. I mean, people get their hands on them whether you notice it or not, right?
Yes. Yeah. So there's a couple of different things around this that we can do to help our people out in the community. So one of the things is getting rid of those drugs, so not keeping them around after you're finished taking them. So One of the things that Blue Cross has done is that we partnered with the National Association of Drug Diversion Investigators, also the state attorney, Jeff Landry's office, law enforcement officials, and then our own community relations department funded placing what we call drug drop boxes in different law enforcement agencies throughout the state. So our goal is to place one in each of our 64 parishes. Currently we have one in each region.
I was going to say, and you can open up the map and see all these little
so if you go
hubs.
to the website, you can find out where in your area these drop boxes are. They're great because they're open 24 hours a day, 365 days a year. It's anonymous. You just drop it in. It's like
so
a mailbox.
we don't know who you are, so that's good. I mean, maybe it's for people who do have an opioid addiction. I mean, this is a positive thing for them.
You can get rid of it. It's anonymous. Law enforcement agencies dispose of the drugs properly, so you don't have to worry about flushing
so don't flush. I was going to say, don't flush them down the toilet. Right. That's not a good choice.
Yeah. So it's great. And then another thing that Blue Cross has participated in for the last 8 years or so is a drug take back day, which is sponsored by the DEA. And we have a big event that's going on in Baton Rouge, but there's also events here in New Orleans, and you can go to the DEA's website. It's April 27th from 10 to 2. And they'll have more details about the different locations. And it's just another way, a big event to come drop off your drugs, no questions asked. And it's great to support the community, get those drugs off the street.
Perfect. Thank you so much. All right, so as she mentioned, National Drug Take Back Day is in a couple weeks on Saturday, April 27th. But those drop boxes can be used year-long. They're housed within law enforcement agencies, and for a list of times and locations near you, head to the website on your screen, bcbsla.com/safedrugdrop, or you can head to the DA's website, that's getsmartaboutdrugs.org, for events in your area.